Don't let anyone tell you anymore that it is not possible to eliminate extreme poverty in Haiti. Fonkoze, the largest MFI in Haiti, and Zami La Santé, the leading health agency in central Haiti, joined efforts with local Haitian partners, global partners, and experts, proven models of poverty eradication from around the world, Asia, Africa, and South America, have been brought to bear to solve the problem of extreme poverty in Haiti. This marks the beginning of the globalization of the anti-poverty movement.
Estelle lives on the Central Plateau of Haiti. Estelle, who is a widow, is not able to send her children to school, but she has found a way to eke out an enterprise. She collects rocks. A neighbor crushes the rocks for her. She's then able to sell the rocks as building material. Many factors can interfere with this fragile enterprise, however. This morning, she just learned that her neighbor, Mano, has had to give his hammer to someone as security for a loan he needs in order to buy medicine for a sick child. Now he can't crush the rocks for Estelle. Marie-Rose is among several thousand patients on the Central Plateau receiving daily medicine for HIV or tuberculosis. Today, she helps in her neighbor's small vegetable plot. Although she feels well enough to work now, she voices frustration as she is unable to find a way to make a living. Estelle and Marie-Rose are defined as extremely poor. A newly formed partnership, however, has emerged confident that extreme poverty can be crushed even in a country as poor as Haiti. Fonkoze is Haiti's largest microfinance institution. Zami La Santé is a large rural primary healthcare provider on the Central Plateau. Together, they recognize the importance of combining their services to accompany people like Estelle and Marie-Rose out of extreme poverty. Anne Hastings, the director of Fonkoze, was determined to put into place a foolproof plan. She enlisted practitioners who work to combat extreme poverty from other third world countries to come to Haiti. Experts from Bangladesh, Bolivia, the Dominican Republic, and Cameroon arrived for a 3-day field study, followed by an intensive 3-day summit. The Anti-Poverty Summit was held on site on the Central Plateau.
Just the fact that we got 4 people from all over the world to come to Tomon, Haiti, and to spend 3 days in the field is just really miraculous. We've been traveling all over the Central Plateau. We met with numerous Fonkoze staff at numerous branches. We met with all of these clients, always trying to distinguish between those people who succeed in microcredit and those people who can't. What is the difference? We met and literally talked for, maybe 45 minutes to an hour with each of all these patients. Almost all of these people are people that are HIV positive. They were living on the edge of poverty to begin with, and the illness took away from them absolutely everything they had.
After 3 days in the field, the global practitioners were joined by local partners for an intensive, interactive workshop led by veteran facilitators.
I want to make sure that we all know what the goal is. That is, eliminating extreme poverty in Haiti in 10 years.
The practitioners quickly went beyond the list of notable challenges to unexpected possibilities.
It surprised me that sick people like HIV positive people, they are also so enthusiastic about having a good livelihood, about earning their own livelihood.
Était différent, c'est-à-dire si les gens avaient plus de
I'm not saying that there is no community, but if there was a greater sense of community, they would be able to do so much more.
social capital missing. For me, that's the golden observation. When she was talking about the isolation, I was wondering if it was only geographical or relationship between people.
When I say isolation, whether it's geographical isolation or individual isolation, I meant both of it, but I particularly would like to give emphasis on this individual isolation.
Interventions from other models were synthesized into the Haitian model.
Obviously then, all models have focused on the importance of training, education, and capacity building.
The BRAC plan is a 24-month model designed to bring a family from extreme poverty to the point where they are able to join a regular microcredit program and be successful. Each process must be carefully engineered and monitored. ProMujer, active in Bolivia and other South American countries, has developed a model of integrated service delivery, all designed to bring about the empowerment of the woman. Simeon Numben from Cameroon of Afriland Bank offered techniques to develop sound agribusiness practices and structures.
With the road situation the way it is, how will they store and get things to market? So the idea of economic interest groups has also been added here.
The Grameen Bank's program for beggar women allows beggars to receive loans with no rules. They can repay whenever they are ready, and there is no interest charged.
The motivation is the number one key part of the program. Motivation, training, and supervision are also in RAC's program, and most likely, and also that should be, in Fonkoze's program. The idea is that within 6 to 8 months to 1 year to 2 years, depending on the level of dependency of this person, they will enter into the mainstream microfinance program.
I like you have brought up the issue of targeting and selection of who we're actually looking to serve. So the team, the Fonkoze Amis La Santé Share Concern Group, reached a consensus that we would target 2 groups of ultra-poor people. One of those groups would be households that had a person living with HIV/AIDS or TB. The other group that we are targeting are households who have an active woman within the household who is also ultra-poor, that the entire household is ultra-poor.
We synthesized all the models that are working around the world right now. We looked at the special circumstances in Haiti, and we adapted those models to the Haitian context so that we have a model that we can actually test in Haiti, a model to shatter once and for all the myth that we don't know how to end extreme poverty. What was the most exciting thing about the summit was that when we ended, everyone agreed that we had put in place a global partnership who wanted to focus their attention on demonstrating that we do know how to address extreme poverty and, in fact, eliminate extreme poverty. The consensus was that we should do that in the country of Haiti to prove to the world that even in a country as poor as Haiti, with no effective government, you can, in fact, eliminate extreme poverty. All we need is the will to do it. Let's do it. Let's show the world what we can do here. If we do it in Haiti, we can be very sure we can do it anywhere else in the world.
The project will be launched in the Central Plateau, where Amis La Santé is already providing care for 75% of those infected by HIV and other diseases, and where Fonkoze is already reaching clients with microfinance services, 90% of whom are women. The program is a grassroots effort that mobilizes communities to identify and support the extreme poor and improve their environment. The program will aim to crush the cycle of poverty in 5 years by targeting the extreme poor and HIV and TB infected and affected households with a well-focused and tailored package of social assistance coupled with business incentives to empower them towards social dignity and economic self-sufficiency. Fonkoze and Amis La Santé invite partners in Haiti and around the world who are committed to poverty elimination to join their efforts to eradicate extreme poverty in the poorest country in the Western Hemisphere.